More quad exercises won't fix knee arthritis, but this will. There's 3 muscle groups that I find in my patients are commonly weak. They're the weaknesses that set up muscle imbalances. And it's not quads. Everybody thinks that the quads are weak and that's why you have a knee problem. That's why knee arthritis comes on. But it's actually that the quads are too strong. The quads are right here in the front of the thigh. They attach to the kneecap. There's 4 muscles, that's why they're called quads. They'll come together and attach to the top part of the kneecap. Then the kneecap has a tendon that comes down, or a ligament that comes down and attaches to this bump right here on the shin bone. And when those quads are too dominant or too strong, they shorten a little bit. And the way to think about this is, if you haven't worked out in a while, your muscles get kind of flabby, but then when you do start to work out, you tone up. When you work out, your muscles tone up because you get what's called an increased resting tension. The tension inside the muscle just at rest, it increases, it's a little tighter. That's why you have more tone, you're not flabby. If you're working out your quads all the time because they're compensating for weakness in those other 3 muscle groups, then you're gonna have increased resting tone, a shortened quad muscle that pulls that kneecap up against the thigh bone harder on a low level, but it's constant. And then because of the attachment from the kneecap to here, it's better shown here. Here's the quad tendon, and then you have that ligament that comes down. If that's just being constantly pulled, then it's pulling the shin bone up against the thigh bone and compressing your meniscus and compressing all the cartilage right here on the end of the thigh bone. Over time, you have this increased pressure, and when you have increased pressure over longer and longer time, the cartilage breaks down. It becomes injured. It can't respond normally. It can't heal normally to overdoing it. So that's how you develop arthritis, and the bone starts to adapt. That's why when you see the x-ray, if you've been diagnosed with arthritis, the doctor will show you that, oh, look at the bone on the inside. It's whiter right here. That means it's thicker. It's adapting. Those are the arthritic changes. Maybe the surfaces are all bumpy. It's like your bone's getting a callus. Just like when you go exercise, if you're lifting weights right here, if you're doing some yard work around the house and you're using your hands a lot, your skin adapts the same way. That's how our body adapts. It gets thicker where there's increased pressure. That's why we get arthritis. There's increased pressure because of the muscle imbalance. And so your poor bone says, well, I don't want to crack, so let me get thicker. And then we talk about osteophytes or bone spurs, osteophytes. Those happen where there's tendon attachments or ligament attachments because of pressures that are building up. The attachment where the ligament connects to the bone is growing because your body right there is saying, well, I don't want to rip off, and there's all this extra pressure, so let me just thicken in the area. Just like you get calluses. See, I even bruised myself on this one because I was lifting weights. That's how the body responds on the inside too. You just can't see it until you get an x-ray, and that's when the doctors are saying, oh, you have grade 2 knee arthritis, and you have a meniscus tear, and we need to operate. No, you need to reduce the pressures first, then let your body adapt to the new pressures, the new lower pressures that you put through your body. You may not even need the surgery at all. Hey, I want to tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it, and it doesn't matter how severe it is, if you've had it just mild, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you through our videos here, then chances are you have benefited from it because this stuff works. Chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program. There's different tiers of this. On the first tier, it's group coaching along with the whole curriculum of 40 plus. I think it's approaching 50 videos now showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements. But you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too, and of course you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program, and I hope to see you in the program on our coaching calls. So the 3 muscle groups that you need to get stronger to combat this muscle imbalance from the quads. Number 1 is your glutes, the back of the hip, the butt muscles. When you get these muscles stronger and you learn how to use them properly, it tells your body to not use the quads so much. There's this concept, this is getting a little sciencey here, but you can Google this stuff, it's all, and I'm gonna say it as simple as I can. The name of the concept is called reciprocal inhibition. Let me break down those 2 words with you. Reciprocal means that something else is responding to you. Like there's another entity that's responding to you. Inhibition means shutting off. So the idea is when you turn on your glutes, you generate reciprocal inhibition with the quads on the front of the hip. That means your quads respond to the glutes activating by shutting down. That's how it should happen, because it's a normal reflex in the body, because when you go to take a step and your foot hits the ground, you're supposed to be using your glutes, they're supposed to tighten up right here, to move your thigh bone back this way so that you can progress your body forward as you walk. And you need your quads to not fire so much so that the glutes can do their job, because if both sides of the joint contract, that we call that co-contraction, then it just stays stiff. And you actually add more compression here at the hip joint. And then it translates to compression down here too at the knee. So we don't want co-contraction, and we don't want the opposite happening either, where the quads are taking over compensation. We want the right contraction to happen, meaning the glutes have to be strong enough and they have to learn how to fire at the right times during activities, so that when you take a step, so that when you get up, so that when you exercise, glutes are active when they should be, and then it's creating reciprocal inhibition, or it's shutting down the quads. And it's telling the quads, you don't need to take over, I got it, I'm supposed to get it right now. This is walking, I'm extending your hip, I'm moving your leg back behind you as you move forward. Quads, all you have to do is worry about swinging the leg forward to take the next step. That's the main idea with the quads there. They're not supposed to be a main driver with walking, one of the most common things. So glutes are number 1 exercise the number 1 muscles that you need to get stronger to fix the muscle imbalance. Number 2, foot. Down in the foot right here, you have a ton of muscles, little muscles inside the feet, but there's some specifically that curl your toes, the ones that bend your toes inwards like this. Those muscles, most of them, they pass right under the arch right here of the foot. And whenever you have a fallen arch, it tips your ankle downwards, inwards, and it moves your shin bone inwards, and then that causes your whole knee joint to have bad alignment. When your knee rotates inwards like this, it puts your quads in a position where they want to compensate. They tend to compensate more, and it actually puts your glutes back here in a position where they don't activate as well. So having good foot strength in your toes specifically to hold up your arches properly is key. It's very, very critical. The 3rd muscle group is your abdominals. A lot of people neglect the abdominals. They don't know how to work them out, or they just feel bad working them out. And it's complicated, because especially if you've had back pain, because there's a lot of people that have knee problems and back problems combined. I can't tell you the number of people that have come in here to see me for their knee problem, made no mention of their back problem, and in order to fix your knee problem, I'm telling them you need to work on your abs. And then a few weeks into treatment, they say, you know what? I hadn't even told you this, and I haven't even realized how bad my back pain was, but it's gone now. This is the best my back has felt in years, because I've had to work on my abdominals. I didn't know that it was going to help me out. The way that I have people work out their abdominals, I have them focus on their lower abdominals. You can go look in our videos and see about that. But working on your lower abdominals, specifically below the belly button, helps you to get great control over the pelvis, the bones where it's the socket of the hip right here, the bottom, where your spine connects to the bottom. If you have a stable pelvis, then everything else below that can move properly. So you set up a foundation for normal movement through your hip, through your knee, all the way down into the foot. So if you get those abs strong, you get the glutes strong, and you get the toe curl muscle strong, the foot muscle strong, then you're set up to fix your knee arthritis problem. Nowhere in this process that I mentioned strengthen your quads more.